Welcome back, everybody. We're diving into a topic I know a lot of you are dealing with every single day.
hmm
Hormone replacement therapy for women after menopause.
Yep.
And we're really going to focus on the latest guidelines today,
hmm
especially the ones that recommend moving away from conjugated estrogens
Yeah.
and medroxyprogesterone.
Right.
Those were the old go-tos for a long
Old
time.
standbys. Yeah. It's definitely a big shift in how we're thinking about treatment.
A paradigm shift.
And it's so important for healthcare professionals like you to stay updated, especially given the potential risks.
Absolutely. The risks with those older treatments. Remember all that talk about the Women's Health Initiative study?
Yeah, I do.
It really shook things up.
Oh, it did.
Highlighted some serious about long-term use of those traditional hormone options.
Yeah, the WHI study back in 2002, it really sparked a huge debate about the safety of HRT, especially the conjugated equine estrogens and medroxyprogesterone acetate. Those were prescribed so widely back then.
Yeah, they were everywhere.
They were.
So let's unpack this shift. Why are we moving away from these treatments?
One big issue with conjugated estrogens is that they're not just one hormone.
Oh, okay.
It's a whole mix, a complex mix of different estrogen compounds.
Ah, I see.
And some of those, they're not even naturally found in humans.
Oh, well,
And that makes their effects less predictable. And it could increase the risk of side effects.
I see. So it's less about mimicking the body's natural hormonal balance and more about just throwing in this cocktail of compounds
All right.
with unknown long-term consequences.
Yeah, precisely. You got it. And then, of course, there's medroxyprogesterone acetate, the
Yeah.
synthetic progestin, the one often paired with those conjugated estrogens.
Okay.
And there's some evidence suggesting it might be linked to a higher risk of breast cancer and maybe even some negative effects on cardiovascular health compared to bioidentical progesterone.
Got it. So that's a pretty strong argument.
Uh,
For choosing the bioidentical route,
Mhm.
what should we be recommending then to our patients who are struggling with those really tough symptoms of menopause?
That's where the exciting stuff comes in. The bioidentical hormones.
Okay.
These hormones are designed to be molecularly identical to the hormones naturally produced by a woman's body. So they work with our systems
Ella.
in a more physiological way, potentially with less risk
Less risk of.
of those bad effects
Yeah.
that we see with the synthetic hormones.
That's fascinating. So instead of using a generic off-brand ingredient, you're using the real thing.
Exactly.
And that way it's more compatible, fewer unwanted side effects.
Yeah.
So what are the main benefits we're seeing with these bioidentical hormones?
The first thing is that they're really good at relieving those annoying menopausal symptoms,
Yeah.
like those hot flashes,
Hot-
night sweats, the things that disrupt sleep and mood,
Yeah.
or just make life harder.
Yeah.
Bioidentical estradiol is a big one for that.
Estradiol. Okay. Tell us more about that one. Why is it so important for women going through menopause?
Estradiol is the strongest of the three main estrogens that our bodies make:
Which are?
estradiol, estrone, and estriol.
Got it.
And it's a key player in everything from regulating menstrual cycles to keeping bones strong, even protecting our hearts. And of course, as estrogen levels go down during menopause, all these things get messed up, which leads to a bunch of uncomfortable and sometimes serious health issues.
So by adding estradiol back in the bioidentical form, are we basically just restoring that balance?
Exactly. You can think of it like putting oil in a car engine that's running low. It helps everything run smoothly, prevents wear and tear. And the cool thing is, with these bioidentical hormones, they come in different forms: pills, patches, gels, creams,
Wow.
even vaginal preparations, so you can really personalize the treatment.
That's amazing. So we have this great tool to help women manage those tough menopausal symptoms. But before we get too far into the specifics of bioidentical hormone therapy, let's make sure we're on the same page about menopause itself.
Good idea. We can get so caught up in the treatments that we forget about the condition itself. So menopause is officially when a woman hasn't had a period for 12 months in a row. Usually this happens between 45 and 55, but it can vary.
And perimenopause, that's often confusing for women. They start experiencing the fluctuating hormones and the first signs of menopause.
Exactly. Perimenopause is that transition time leading up to menopause, and it can go on for years. During this time, the ovaries gradually produce less estrogen and less progesterone, causing those hormonal ups and downs that trigger a lot of the classic menopausal symptoms.
Okay, so let's talk about those symptoms. What are some of the most common things women experience during this time?
The most common is the hot flash, that sudden feeling of intense heat
Yeah.
that can spread through the body, often with sweating and flushing.
Oh, yeah.
Up to 80% of women experience them.
Wow.
And for some, they can be really frequent, really disruptive. And then there are the night sweats, which are basically hot flashes that happen during sleep.
So they wake up drenched.
Exactly. And have restless nights. And of course, it's not just about those vasomotor symptoms.
Right.
Menopause affects a lot of different systems in the body.
It's a whole body experience.
It is. The genitourinary system is really affected by those declining estrogen levels. Vaginal dryness and atrophy are super common. Up to 50% of women experience this. And it can lead to discomfort during sex and even increase the risk of UTIs.
And the emotional and cognitive changes, too, that often go along with menopause?
It's not just physical, it's a whole life transition.
It really is.
Yeah, mood swings are common, irritability, and even an increased risk of depression, all part of the picture. Then we have the cognitive side of things. Many women complain of brain fog, of feeling of difficulty concentrating, remembering things, and just feeling mentally slow.
Yeah, it's like this domino effect.
It is.
Affecting our sleep, our mood, our focus, and then the long-term health risks.
With those declining estrogen levels, what are some of the things we need to be talking to our patients about?
A major concern is the increased risk of osteoporosis. Estrogen is really important for keeping bones strong.
Right.
So when the levels drop, bones get weaker, more prone to fractures. This is a big issue, especially as women get older, and falls become more common.
Yeah, we have to think about that.
And we can't forget the impact on heart health. Estrogen plays a protective role there, too.
I know it does.
Absolutely.
Yee.
As those levels go down, there are changes in lipid profiles, an increase in LDL cholesterol, the bad kind, and a decrease in HDL, the good kind.
So bad for the heart.
It is. It can lead to plaque buildup in the arteries, increase the risk of heart disease, and stroke.
It's a lot to think about. So many symptoms, short-term and long-term.
It is.
All because of these hormonal shifts. So bioidentical hormones really do seem like a promising avenue.
They do. But before we go deeper into those treatments, let's take a closer look at the risks associated with those older hormone therapies, the ones we're moving away from.
Yeah, let's do that. It's good to understand why the shift is happening and what the evidence actually tells us.
Exactly. Let's dig in.
Okay, so let's get into those risks a little deeper.
Okay.
One of the main concerns with conjugated estrogens, the type in those old HRT formulations, is how they're processed in the body.
Processed. How?
They break down into these various metabolites, and some of them have been linked to a higher risk of certain cancers, especially breast cancer.
Oh, okay.
And because those conjugated estrogens come from horse urine, they're not exactly the same as the ones humans make naturally.
Oh, I remember that. So it's almost like we're, I don't know, taking a chance.
Yeah.
By putting those foreign compounds into a woman's system.
That's a good way to put it.
Like, we don't really fully know what they'll do long term.
Exactly, and that's part of the reason for the shift towards bioidentical. Now, with the medroxyprogesterone acetate, the synthetic one that's often with those conjugated estrogens, there's evidence that suggests it might be worse for breast tissue and the heart than bioidentical progesterone.
Okay, that makes sense. So what about women who have had breast cancer or have a family history of it? Is HRT, even the bioidentical kind, off limits for them?
That's a tough one. It really depends on each individual woman. You have to look at their risk factors and have a conversation about the potential benefits and the risks. For women who have had hormone receptor positive breast cancer, HRT is usually not recommended. But for women with just a family history, no personal history, it's not so clear cut.
So it's not a straight no.
Right.
It's weighing those individual risks and benefits.
Exactly. And that's where those bioidentical hormones might be better because they're the same molecularly as what our bodies make. They might be safer, but we do need more research on that. And the good thing is you can adjust the dose and the delivery method with bioidenticals. So that helps lower the risks too.
Okay, that makes sense. So let's get more into these bioidentical hormones.
Yeah.
We talked about estradiol being important. What about the other estrogens, estrone and estriol?
Right.
Do they have a part in HRT?
Yeah, they can. Estradiol is the strongest and usually the main one used in HRT.
Okay.
But estrone and estriol can be in there too. They just have different roles. Estrone is what your body turns estradiol into. It's often found at higher levels after menopause. And some experts think it might help protect bones.
Oh, interesting.
So even though it's not as strong as estradiol, it's still important for that balance. And then estriol, it's called the weaker estrogen.
Like it.
Yeah, because it doesn't attach as strongly to those estrogen receptors in our cells. But it's still important. Some research suggests that it might be less likely to stimulate breast tissue compared to estradiol. but we need more studies to be sure.
So estriol could be a good choice for women who are worried about breast cancer.
It could be, yeah. But again, it all depends on the individual woman and her risks. Now, let's talk about progesterone. We said earlier that micronized progesterone is better for women with an intact uterus.
Because the synthetic progestins, like medroxyprogesterone acetate, have those increased risks we talked about.
Exactly.
So bioidentical progesterone is safer.
Yeah, because it's the same as the progesterone our ovaries make. It works with our bodies more naturally, and the studies say it has a lower risk of those bad effects compared to the synthetic progestins.
That's good to hear. I know there are a lot of different ways to take these hormones. Pills, patches, creams.
Yeah,
How do we know which is best for each patient?
I guess it really depends, right? There's no one size fits all. That's right. That's where personalized medicine comes in.
Okay.
We have to think about the specific hormone, the patient's preferences, their lifestyle,
Yeah.
and even if they might have side effects with different methods.
Let's talk about that. What about taking the hormones as a pill? What are the pros and cons of that?
Pills are easy to take, and they're usually absorbed well.
Yeah.
But they have to go through the liver first, which can change how they're broken down and might increase the risk of certain side effects, like blood clots. So if a woman has a history of blood clots or a clotting disorder, we might try something else.
That's important to know. What about patches and gels? I know those are getting more popular.
KR, yeah.
Why is that?
Patches and gels don't go through the liver,
Okay.
which is better for safety. They also tend to keep hormone levels more stable, and some women just find them easier than taking a pill every day. But there can be some downsides. Some people are sensitive to the adhesives in patches,
Yeah, it can happen.
and finding the right place to put the patch can be tricky.
I can imagine.
So it's always about finding that balance between what works well, what's convenient, and what the individual can tolerate.
That makes sense. What about creams? I know those are often used for specific areas.
Yeah, creams are good for those genitourinary symptoms we talked about, like vaginal dryness and atrophy. They're easy to apply, and you can control the dose pretty well. But absorption can be a little unpredictable, and some women think they're messy.
I understand. So each method has its own quirks.
It does.
It sounds like talking to the patient is really key to figure out what works best for them.
It's a team effort. We talk about the options, weigh the pros and cons, and then together choose what works best for their lifestyle and their goals. But remember, it's not just about choosing the hormone and the way to take it. We also need to find the right dose.
Oh, that's right. How do we do that? Is there a standard place to start?
Huh.
Or is it more trial and error?
It's more individualized. We usually start low and increase it gradually until the patient feels better without any bad side effects.
So we're aiming for that sweet spot where it's working, but not causing any problems.
Exactly. And the dose might need to be adjusted over time as things change and the body adapts to the therapy.
I see. It's not just set it and forget it. You have to keep an eye on things.
Huh.
Now, I want to go back to something you mentioned before. The long-term risks that come with those declining estrogen levels, especially osteoporosis and heart disease. Can bioidentical HRT help with those?
That's a good question. It's been studied a lot. The evidence suggests that HRT, even bioidentical, can help prevent osteoporosis, especially in women who are likely to get fractures.
So for women who can't take other osteoporosis medications, bioidentical HRT could be a good choice.
It might be, yeah. But you always have to weigh the potential benefits against the risks, like with any treatment. And with heart disease, it's a little more complicated. Some studies say that starting HRT close to menopause, especially the transdermal estradiol, might protect the heart. But other studies have shown a higher risk of heart problems, especially if a woman starts HRT later in life.
So when you start, HRT seems to be really important.
It does seem that way, yeah. And individual risk factors play a big role, too. We need more research to really understand how HRT and heart health are connected.
Because this is a field that's constantly changing.
It is.
What we know today might not be true tomorrow. But for now, it looks like bioidentical HRT is a safer, more effective option than those older synthetic hormones. What are some of the most important things healthcare providers should think about when they're talking to their patients about bioidentical HRT?
First, you have to do a thorough assessment, medical history, family history, to see if there are any reasons why they shouldn't take it,
Okay.
or any risk factors, and you need to understand what they're looking for, what their goals are. Some women just want to get rid of those hot flashes and night sweats,
Yeah.
while others are more worried about the long-term risks.
So we have to listen to the patient and create a treatment plan that fits their specific concerns.
Exactly. And it's important to have an honest conversation
About
about the good and the bad of bioidentical HRT. Talk about the different hormone options, the ways to take them, the doses, so the patient can make an informed choice, one that they feel good about.
So it's a shared decision,
Yeah,
not us telling them what to do.
it's working together to find the best way forward. And of course, we have to keep checking on them, make sure everything is okay. Absolutely. We need to see how they're responding to the treatment, adjust the dose if we need to, and keep an eye out for any side effects. That ongoing communication is key to making sure things are working and keeping them safe.
This has been so helpful, really eye-opening about these new guidelines and these bioidentical hormones.
Mhm.
But there's just so much information out there and misinformation. It can be hard to know what to trust.
It can. It's a lot to sift through.
How can we stay up to date
Mm.
and help our patients do the same?
That's a great question, and we'll talk more about that in the next part of our deep dive. We'll look at how to evaluate research, how to find reliable sources, so we can be better guides for our patients as they go through this big life change.
Sounds great. I'm looking forward to it. One of
Yeah.
the hardest things for me with HRT is all the information out there
Yeah.
and misinformation too.
It really is a lot.
It's like everyone's got an opinion. My friends, my family, bloggers, people online saying they're expert.
It's overwhelming for us and for patients too.
It is. Patients come in with all these articles they've read, stories they've heard. We got to help them figure it all out.
Absolutely. Make sense of it.
Yeah,
So how do we do that? How do we know what's real and what's not, especially with all that stuff online?
exactly.
I think the first thing is to remember that everyone's got a bias,
Okay.
even in research. Who's paying for the study? How is it designed? What do the researchers themselves believe? All of that can affect the results and how we understand them.
So we can't just look at the headline
Nope.
or give them the abstract.
Got to go deeper. Really look at the source
Yeah.
and how they did the study.
Okay, that makes sense. But honestly, most patients aren't reading those long research papers.
Right.
They're looking at websites, blogs, social media. So what should we watch out for when we're looking at those online sources?
Big red flag. A website trying to sell you something. If they're pushing one specific product or brand, be careful.
Okay.
They probably care more about making money than giving you good information.
So be skeptical of those commercial websites.
Yeah, definitely. Another red flag is those headlines that are like super dramatic, or use scary language, or promise miracle cures.
Too good to be true.
Exactly. If it sounds like that, it probably is. And remember, just because someone tells you their personal story, that doesn't mean it's true for everyone.
Well, that's such a good point. Stories can be powerful, but they don't replace real scientific evidence. What do we do when a patient comes in with information they found online?
Talk to them. Ask them what they're thinking, what questions they have. Don't just dismiss what they found. Use it as a chance to talk about how to evaluate information.
So we're teaching them how to think critically.
Exactly. And showing them where to find good sources. What are some reliable resources for information about HRT and menopause?
Yeah, what are some that you recommend?
Professional organizations are a good place to start, like the North American Menopause Society, NAMS,
Okay.
and the Endocrine Society. Their websites have lots of evidence-based information, and they have guidelines for healthcare providers.
Oh, I use those.
Yeah, and they're updated regularly to keep up with the latest research.
They're great resources. I refer my patients to them all the time. But even with the best information, it's tough to keep up with everything that's new. How do you do it?
It's definitely a challenge. Going to conferences helps, reading the journals, taking those continuing education courses,
Right.
and I try to set aside some time each week to read the new research.
It's like anything in medicine. You have to keep learning your whole career.
You do, to make sure you're giving your patients the best, most current care.
Exactly. And I think it's okay to say, I don't know, sometimes.
Yeah.
If there's a question we can't answer, or a case that's really tough, we can always ask our colleagues, talk to specialists, or just say, I need to do more research.
Absolutely. It's about putting the patient first and knowing that we're always learning. This has been a great deep dive.
It has.
Really helpful. We've talked about so much, those new guidelines, the risks of the old treatments, and all about bioidentical hormones. What are some key things you want our listeners to remember?
Oh, that's a good question. What are the big takeaways?
The main one is that HRT is not a one-size-fits-all thing. What works for one woman might not be right for another.
It's got to be personalized.
It does. We have to look at each woman's medical history, her symptoms, her risks, and what she wants to get out of treatment.
A personalized, patient-centered approach.
Exactly. And when we are thinking about HRT, we need to remember those risks. With the older synthetic hormones, like conjugated estrogens and medroxyprogesterone acetate, bioidentical hormones seem to be a better option. They're like the body's own hormones, and they might be safer and work better.
It's about giving our patients the information they need so they can make good decisions about their health.
Exactly. And one last thing. Menopause is not a disease.
Right.
It's a normal part of life. And with the right support, women can go through this transition feeling good and confident.
I love that. It's about empowering women
Mm.
to own this new stage of life and advocate for themselves. To all our listeners out there, thank you. You're doing important work helping women navigate this complicated part of life.
You really are. Keep learning, keep asking questions, keep talking to your patients.
We're all in this together, always learning, always trying to give women the best possible care during this time.
That's right.
That's it for our deep dive into HRT. Until next time, keep learning, stay informed, and keep those conversations going.